Just before I open it up, I have one question to Dr. Sainani. Is there a way in which we can find out how healthy or unhealthy our gut microbiome is?
I think if you don't have any particularly gut symptoms, I think they're reasonably healthy. But are they responsible for metabolic symptoms? That's a possibility, seeing the amount of trial and studies that we have. There are certain labs now who are processing your gut microbiome. So they give you kind of a signature. You'll have some of your more affording patients who have been doing that when they go overseas. It's a thing which is freely available in the US. But now certain labs in Mumbai have started it. But we don't know what to do with that data. They come with a report because we don't have what is called a normal data of India, and lot of the data is from China and certain European countries. And even if you look at the data from China, you will see the hilly areas have different microbiome from the plain areas, have different microbiome from there's so many variable factors that I think we are a long time away to really act on that.
Yes, the question is similar, that how to diagnose that it is. Better to use the mic. How to diagnose that it's
the gut microbiome.
Leaky gut.
So unless you have GI symptoms where you would need to see your physician or your GP or your gastroenterologist, I don't think you need to worry about it.
But any specific GI symptoms, because GI
yeah,
symptoms
so there are like
so
she
many.
mentioned so many symptom diseases which may be associated. What we noticed that patients of PCOD, there are studies which have shown that have a higher incidence if you take prevalence in normal population of irritable bowel syndrome. So patients, those are the subgroup of patients who may come to us. They will have PCOS with IBS. So then I think if in the normal population it's about 15%. If you take the PCOS patients, it's about 30 to 35%.
Yeah, if you have patients who are presenting to you with unexplained bloating, unexplained weight gain, you would constipation, it's very, very common these days. You need to actually go into the details and talk to them. You'll possibly be able to help.
I think we have a lot of nutritionists on board, and I think that's a great thing. And I want to ask Dr. Abha Majumdar, do you recommend a nutritionist referral for your fertility patients?
Generally not, because I think ours is still a one-stop consultation for infertility. But yes, definitely for the obese and all obese, whether they are PCOS or not, and PCOS especially, there is a very important role of a nutritionist, because diet plan, as we just heard, that diet is 80% responsible for the weight and 20% is probably exercise. So without changing the diet plan, we cannot just change the dynamics of weight gain or weight loss either.
So in the same breath, let me just ask you, there are certain tests available for implantation failures, and there are companies promoting this. What is your take on it?
See, right now we do not really, we have not gone into the microbiome. I know that a company has come up with a recurrent unexplained implantation failure with a test called endometrial receptivity array. The same company has come up with Alice and Emma also. And we went into details, we did some tests, but it was so inconclusive that at the end of it, what I started doing was that if I really got a true case of recurrent implantation failure with very good embryos, no reason to explain why they failed, I started putting them on a 14-day antibiotic and a 28-day probiotic course, thinking that it might help rather than putting them across these tests, which costed to my patients 82,000. It was much easier. I mean, I've seen people giving ATT right, left, and center, which I have antagonized since I've come into practice of infertility, especially in northern India. It was like the biggest vice which girls went through, in 6 months, 9 months, 1 year, 1.5 years of ATT. I think vis-a-vis that, 2 weeks of an antibiotic, maybe the megalocide antibiotic like erythromycin or doxy would have a much better placement there.
2-3 questions, Rajesh. Number one, how does the microbiome transfer genetic material to the other person? How does the genetic change occur with only transfer of the microbiome?
So we don't know exactly why, because if they can transfer genetic material, they can also transfer infections and other predisposition. But I think whatever it is short-lived. You're saying this is microbiome during the FMT transplantation, right?
Yes.
Yeah. Yes. For obese, yeah. So again, some of these tests were done in rats and not in humans. And even if we have to understand that the effect is only on that day, because after that you pass off the stool, and unless you're doing it recurrently. There are certain Clostridium patients in which we would have to do 3 or 4 sittings. Do some of them remain permanent and long term? I don't think so. But I don't think we have enough evidence. This is, I'm just telling you hearsay evidence from the few papers which showed that when obese mice were given to lean, they looked at these parameters, insulin sensitivity, insulin resistance.
No, that I understand,
Yes.
but how does the genetic components
I
change?
don't-
Proteins are encoded
Proteins.
by all these microbiome. Lot of proteins are encoded, much more than what.
But can it
our
change
cells
the genetic code? It's very. I mean,
No,
I wanted to
because we are
understand
saying, I think on one side we are saying the microbiomes are responsible for obesity.
Correct.
So on the other side we are saying that if you change the microbiome, are you able to tackle the metabolic syndrome?
Yeah.
So I think it's just
That's a
one
different
one
thing.
spoke of the whole
That's
wheel, and
absolutely, yeah.
we
The other-
can't complete the.
The other question was that we are aware that there's a lot of lactobacilli in the vagina. And is there any particular probiotic you think which works well with lactobacilli?
I use an oral probiotic by the name of Ecoflora. That is the only oral one I know of, and there is a Inu which is used as a vaginal pessary. So these are the two which are generally commonly available for use.
But is it specifically for lactobacilli?
For lactobacillus only, and the rhabdoceus.
Yeah,
These two species.
we've been using the various probiotics available in the market, but not necessarily. We
No,
don't know.
these are vaginal probiotics. These two, the names which I took.
Okay, fine. Take it. Thank you.
I have a question for Anita. Now, Anita, you said something about eating fruit and don't eat it in the, I think you said don't
eat it in the
evening, but
morning.
eat it in the morning.
Yes,
But many
absolutely.
dietitians do recommend that you should eat fruit at 4 o'clock because to cut the gap between lunch and dinner.
So what I have been going through and the research that I recently did for leaky gut, they clearly say that your chances of developing inflammation are more when you go on sugar, whether it is processed or natural sugar, in the latter half of the day than when you do it in the morning, because you tend to burn that whatever you have consumed through the day. Hence, it is better consumed in the first half of the day rather than the second.
I think there's a recent study in JAMA or Lancet, I think, which was so simple, which said that people who did a 2-minute to 5-minute walk, what we were told by our parents or our grandparents, टहलने जाना, dinner के बाद, you don't have to walk fast. It doesn't have to be long. The study has shown that 2 to 5 minutes of walk after a meal improved your blood sugar levels. It's a fabulous article, I think, just in the last 1 or 2 months. Jama.
It's a 1,000 steps after dinner.
Yeah, something. And I think we used to just wonder why our grandparents always said that, and I don't think any of us, I think we walk from the dining table to the sofa to on the... Yes.
So does that walk need to be a brisk walk? Or
No, not at all. Not at all. So the reason this came up is because now we have those, lot of people for health and fitness, not necessarily diabetics, are putting those continuous markers. You have an app on your phone and you can measure your sugar. And they realized the thing what was helping them most was the walk after this. And that's how the data started getting collected. Yeah.
It also, that fruit thing which you said, there's a glucose goddess, if you on apps, on all the mobile apps. She says that if you take a fruit bowl first thing in the morning, your sugar would spike so high. But if you take it after a cereal or something which is a good carb, which stays in the gut for long, then you take your fruit, it is much better. We always did the reverse. So I don't know, the theories go on changing, and the glucose rise is very, very important according to me in all of us, especially the group we are talking about, the PCOS. So I think we have to do more research on the early morning fruit or the late morning
I
fruit.
think we have a nutritionist on board. Would you like to say something, and then we'll go to you? Yeah, sure. Yeah, why don't you take the mic, introduce yourself, and then...
She wanted to ask a question.
Yeah, she's just talking on this topic, then we'll go to
Okay, so I'm a nutritionist also, and I have done my specialization in gut microbiome and human nutrition. So I will like to put some light upon this fruit thing. When we talk about fruit, not necessarily you need to eat it just first thing in the morning or the first half. The point where you discussed about, fruit playing a role as increasing the sugar, that really comes into picture when you're having certain type of fruits which are just having more sugar as compared to the other, because there are fibrous and there are pulpy fruits. But the reason why fruit is not consumed after a meal is the simple thing that it has got sugars, and then that is going to spike the sugar levels immediately. The reason why we give fruit at 4 o'clock is because that is where, most of the time, most of our Indians end up eating something wrong. So you can combine the fruit, but we often recommend combine this fruit with dry fruits so that there's a combination of a protein and a carb. So we work on this protein and carb combinations, and that is exactly what I think this glucose goddess also works upon, where we are having a combination of protein, fat, fiber, everything put together, and that is what actually does not spike the sugar. In addition to that, it is going to give you the prebiotics which is coming from the fruits, as well as one more thing to add over here. Ghee is something which we are commonly consuming in all our diets. A lot of dietitians are also stressing upon why you should be having it. And in fact, in the studies that I have done, the saturated fatty acids in ghee is something that increases the gut microbiome. So we insist that you consume ghee in the diet, either first thing in the morning, that is fat first, or then that fat first actually lowers the insulin spike throughout the day. So you can have it fat first in the morning, or you definitely add it to your meals, in your lunch and in your dinner. So it's a balanced plate which we talk about all the time.
I think next question, yes, would you like to introduce yourself and then...
Yes, ma'am. I am Dr. Shraddha. I am Partaseva. I am practicing at Barshi, Solapur. I wanted to ask regarding the new formulation that has come, vaginal pessary with pre-probiotic.
Which one?
I don't
I'm not
exactly remember the name, but I don't like... Yeah, I don't think it works, but I just wanted the opinion. Vaginal pessary.
I think
as a
one minute.
prebiotic.
I think you are asking about the vaginal probiotic. Are you asking?
No,
I
ma'am.
think that is-
Vaginal probiotic pessary.
Yeah, the vaginal probiotic pessary
This
is what
is by
Dr.
the
Abha
name of-
already mentioned.
Inu is the name for this. It is a vaginal probiotic. Like we have oral probiotic, I know only of one Ecoflora which I've started to use. So expensive. It's 10 tablets for 1250 rupees. So it is
But
quite
ma'am,
expensive.
when we were doing MBBS, during that time it was said that if we put directly microbiome in the vagina, it is not going to work. So how does this pessary work?
I'm sure it has a mechanism to work, and if it's
Then
vaginal.
if it was to be discovered
And the oral
before,
one-
then why did
oral
it take
one
such a
would
long
go-
time to discover, like after so many years?
I don't know, I'm not the manufacturer of the pessary. I've just known that this is a pessary which increases the lactobacillus of the vagina, and so is that oral one also, which goes through the gut microbiome, increases colonization of lactobacillus in the rectum, and that's how it acts on the
Ma'am,
vaginal.
one more question. Sir had said that the infants who are delivered by C-sections and vaginal deliveries and who are breastfed and bottle-fed, they are having different microbiome. So how will it affect it in the later part of their life?
So because the microbiome, what gets colonized in the colon depends upon, because if it's a vaginal delivery, you are getting the maternal fecal bacteria, and if you're doing a C-section, the child is lying on the abdomen of the mother, you're getting more of the skin. So because there actually in diabetics, there have been studies. So what they have tried to do intervention in the first 15 days. So they have tried there are certain genetic conditions where the risk of developing diabetes is very high in the sibling, like to develop insulin-dependent diabetes. And so they try to do this intervention in the first 15 days of birth. So they look at vaginal delivery or they try to replace with oral probiotics with the hope to alter the child as they go, because the bacteria formed there are what remain.
And the later
They are the predominant bacteria all through your life.
Okay.
Things can change it, like everyone discussed. Stress, your antibiotics you take, the environmental you grow up in. But the basic thing is the same.
Two more preparations, Dr. Abha, are Florita LL by Sun and Combinom by Abbott. They are also same, probiotics for.
There's one good news I want to bring out over here, that we are doing a course on nutrition through the PCOS Society of India. It will be done in collaboration with the SNDT University. It's in place, and hopefully in the next 3 months it should be ready. It's a combined course both for nutritionists and for gynecologists who would like to do it, and it has 3 sets of 15-hour modules. The first set is conducted by gynecologists to let the nutritionists learn what is PCOS, etc., etc. And the second module is for the nutritionist to teach the gynecologist what is, or even family physicians about nutrition. And the third section is where both get together and solve the cases side by side. So it's going to be a certified course. We are already working on it, and hopefully in the next 3 months it should be done. So we'll announce it, and I would like everyone to join in.
Ma'am, I wanted to ask which one is better, the vaginal or the oral vaginal?
I don't know. We have no clue. I use the oral one somehow because there's no evidence,
So I think that the evidence for the vaginal is that recurrent patients who have recurrent discharge and recurrent vulvovaginitis are benefited by using this vaginal probiotic pessary
Also
for
oral.
a certain days
Also oral.
in the month.
Good afternoon, and thank you PCO Society for having this such an important topic that we are discussing today on gut dysbiosis. One question that we have been talking all the time about food and the type of diet and everything. Some years ago, I remember we had one conference where Dr. Yagnik from Pune, I had read quite a few papers where they have done a good study in the neighboring villages where they talked about the water that was being consumed. And all our water comes in a filtered form, we lose the minerals, and we have different kind of bacteria. Like, imagine ourselves 20 years back, we would drink water anywhere. I can vouch that Anita also had pani puri around KM hospital, but now which we would not really dare to do. So is water the change that we are taking filtered water, we are losing the minerals, and we are having a different kind of a gut now with different kind of water intake? Is there anything to support this? Because they also came up that this kind of water intake is causing B12 deficiencies as well. So is there anything that you would like to add on?
So I don't know whether it causes B12 deficiency, but let's look at it the other way. I think as we grew up, at least our generation drank water straight from the tap without having it filtered. And now we are used to more bottled water and more this. So if you look at it, sanitation has improved basically, what we are trying to say in a way. That's why following what the Westerners had, we are now seeing more autoimmune disease today than we saw when we were doing our MD 20 years ago. So we don't know whether this is because of a change in gut microbiome. This is what my teacher, Professor H.G. Desai, used to tell us, that the reason India is now catching up is because of improvement in sanitation. You're seeing more infections and allergies and peanut allergy, which all our relatives' kids, Indian relatives' kids born in USA would have, but nobody in India would have. But now we see the same type of parents in India telling children not to pick up food from the floor and all those things. We are also getting more obsessive about sanitation, hand washing, and things like that. I think the improvement in sanitation, H. pylori, like we talk about gut infections, and American population, 10% of the population has H. pylori prevalence. If you look at India, by the age of 15, more than 50% has. So it's such a high percentage. Obviously, it is the water. So does it impact the immune system? Yes. We have seen in this pandemic, our response, the Western response to respiratory diseases, and now was very variable. We thought we are better off. And you see now, when we are getting our masks off, everybody who's getting a diarrhea or a sore throat or a cough is having a prolonged infection. We are not seeing recovery so fast. So I'm sure small doses of unclean water helps. So occasional pani puri maybe will help you. I'm just trying to say, we don't know. These are just hypotheses. There are no studies on this. Yeah, we are in a medical conference, but it's possible.
I'm sure as a gastroenterologist, you don't say that. Yeah.
No, actually, I don't think, I think 99% of these patients get taken care by the GP. And we get only the difficult ones who can't be solved, I think.
I think with that, we'd like to, wonderful discussion, and we'd like to thank all our speakers. And would you like to say something?
Yeah. I think this was an extremely good session. Yeah. And thank you organizers for having us. Thank you.